If you're going on to Medicare and wondering how prescription drug coverage actually works, you're in the right place. Today, we're breaking down Medicare Part D, common mistakes people make, penalties to avoid, and what you should know before choosing a drug plan. The first thing that people need to be aware of when it comes to Medicare prescription drug plan is there's two ways that people can obtain drug coverage from Medicare. The first is what we like to call a standalone prescription drug plan, and the second is with a Medicare Advantage plan, also known as Part C, and we're gonna break both of them down today. The first thing to really know is no matter which way that you do this, whether it's a standalone drug plan or a Medicare Advantage plan, your prescription drug coverage is going to come through a private insurance company. Okay, so companies could be Humana, WellCare, SilverScript, Aetna, just different companies like that are going to have your prescription drug plan. And there's some differences between them, and we'll talk about that later on. But the biggest thing to know, no matter whether it's a standalone drug plan or a Medicare Advantage plan, it's going to come from a private insurance company. So let's break down the first way to obtain prescription drug coverage. That is with Original Medicare, and if you have a Medicare Supplement. So Medicare Supplements do not include prescription drug plans. So that's where this comes in as a prescription drug plan or a standalone Part D plan. Again, it's a private insurance company, and you're gonna enroll into this as a standalone prescription drug plan, okay? There are tons and tons of different options out there. So what are different things that you need to be aware of when choosing a prescription drug plan? And the first thing that we always want to talk about is how to avoid penalties when actually signing up. So there's very specific enrollment windows when you go to sign up for whether it's a Medicare Advantage prescription drug plan, also known as Part C, or a standalone prescription drug plan, also known as Part D. So how do we avoid penalties? Well, the easiest way to know that you're doing that is to sign up for that drug plan you have as early as 3 months before your Medicare start date. And for prescription drug coverage, to avoid any penalties, you have up to 63 days after your Medicare effective date. So just as an example here, if my Medicare start date was May 1st, I would have 63 days after May 1st to avoid a penalty. And what does that penalty actually look like with Part D? It is going to be 1% of the national average cost of a drug plan every month that you could have had the coverage, but you elected not to enroll. Okay, so unfortunately, we have seen clients that have called in or came into our office that no agent ever told them about this, and they went 10, 12, 14 years without a prescription drug plan, and we've seen penalties as high as $70, $75, $85 per month for the rest of their life. So it's super important to avoid any kind of penalties, and the best way to do that is by doing a timely enrollment, okay? So that's the first thing to note with prescription drug plans. Now, how do prescription drug plans actually work? So before I talk about our process here at Greening Health and Wealth, I think it's important to understand fundamentally how prescription drug plans actually work and how they've evolved over the last few years. So for those that don't know, back in 2024, this was the first year in all of Medicare. So from the entire timeline that Medicare was created, 2024 was the first year we had what's called an out-of-pocket maximum limit on prescription drug plans. So in 2024, that number was $8,000. That was the most you could spend on covered prescriptions in a calendar year. And this came from what was called the Inflation Reduction Act with Medicare. I'm gonna touch on this a little bit more, but anytime before 2024, they had what's called deductibles, donut holes, and then there was never a maximum out of pocket. So we have seen clients spend thousands and thousands and thousands of dollars on prescription costs. So what does the Inflation Reduction Act mean, and what does that mean for you? So in 2024, that was the first year we eliminated the donut hole, and then $8,000 was the cap. That was the most you could spend on prescriptions. 2025, that number went down to $2,000, so that's a big, big jump. So $8,000 down to $2,000. 2026, as of right now, the most you could spend on prescriptions in a calendar year is $2,100. And then in 2027, that number is going from $2,100 up to $2,400, $2,400. And that is the most that you could spend on prescription drugs in a calendar year. Now, what's the caveat to that? The most important piece of this is your prescription has to be on your plan's formulary to go towards that maximum out of pocket. So again, this year, the $2,100, next year, the $2,400. So what does being covered on your plan's formulary actually mean? What does that mean for you? How could you do that yourself? Or where does a place like us come into play? So being covered on your formulary, when it comes to prescription drug plan formularies, most common 5 tiers of prescriptions on that plan. Tier 1 is preferred generics, Tier 2 are generics, Tier 3 are preferred brand, Tier 4 is non-preferred, Tier 5 is what they call specialty tiers, and in some cases, they do have a Tier 6 select care drugs. Very rare that we actually see that. But what I mean is your prescriptions have to be tiers 1 through 5, and how they determine that is Medicare has a rule that every company and every plan has to cover at least one prescription in every therapeutic category. So that means that some prescription plans may cover other prescriptions in that category, but they are not all going to cover all of your prescriptions. So it's super important to have someone as a resource on your side that knows the ins and outs of prescription drug plans, the formularies, the plan changes every single year. Formularies change, the prescriptions that are being covered change. Everything about these prescription drug plans change every single year, so it's important to have a good resource on your side to get you those updates, those changes every single year. Another example why this may be super important are for prescriptions. Let's use insulin as an example. As of right now, insulin is capped at $35 for a 1-month supply. But again, the caveat to that is that insulin has to be on your plan's formulary. So if you try and do this yourself and you either type in an insulin wrong or you just never check the formulary because you just assumed it's gonna be capped at $35, you could actually be paying hundreds and hundreds of dollars for your insulin, where we could have very easily avoided that and got you at $35 for a 1-month supply. So it's super important to have the right resources and the right people in your corner to help you check those things. Another common example that we are seeing with drug plans right now is there was a change. For those that haven't seen it, the current administration has made GLP-1s more accessible for Medicare beneficiaries. So before right now, the rule was you needed to have some form of diabetes to have your GLP-1s covered by a prescription drug plan. But now they are broadening the access to that starting June 1st of 2026. So what does that actually mean? Be on the lookout. Some plans are actually dropping current GLP-1s to make room to restructure the formularies for the GLP-1s that they want access to. So it's super important if you're getting these letters, prescriptions are being dropped, plan tiers or prescription tiers are actually changing right now. So those things can happen. It's very rare, but they can happen in the middle of the year. So that's what's happening right now. So our process here at Greening Health and Wealth is we're gonna input your prescriptions, your zip code on Medicare.gov. You're gonna choose your pharmacy, and then right there, it shows us all of the options available in your zip code, in your county. And it gives us the total cost from lowest total cost to highest total cost for the rest of the year. And then we can break that down with you. When are you gonna hit your deductible? If you're gonna hit that $2,100 max, if something's not covered by a plan formulary, maybe it's covered by some plans, maybe it's covered by others. So we're really gonna break that down with you in an easy to understand way. And then we're gonna have just the perfect roadmap for you for the remainder of this year for prescription drug plan. And then super important, we reevaluate this with you every single year, October 15th through December 7th during the annual enrollment period. Remember earlier I said plans change, formularies change, how prescriptions are covered, those change every single year. So we review these for all of our clients every single year. So remember, Medicare Advantage Part C is when a private insurance company comes in and they combine your Part A, your Part B, and your Part D. They mash it all together and they call that Part C. The main difference with getting your prescription drug coverage through a Medicare Advantage plan is, remember, it's not just your prescriptions being covered on there. So we also have to check your doctors, your hospitals, and your preferred pharmacies and make sure they are all covered on that plan to make sure it's a good fit. So the fundamental pieces, the $2,100 out-of-pocket limit, $2,400 for next year, prescriptions having to be covered on a plan formulary, coming through a private insurance company, those all are still the exact same, whether it comes from a Medicare Advantage plan or a prescription drug plan. So with drug coverage coming through a private insurance company, there's one thing I always like for clients to be aware of, and those are prior authorizations, what we call step therapy, and then formulary exceptions. So again, when your drug coverage is coming through a private insurance company, one thing a lot of people don't realize is you will have prior authorizations, maybe even for prescriptions you've taken for 10, 15, 20 years. So that is a new thing for you when you do get to Medicare, and that's something to be aware of, especially the first year that you're on Medicare. So how a prior authorization works again is your doctor that you see is gonna send in information. They're gonna send it to the insurance company. The insurance company looks at it, they approve it, and you can go get your prescriptions. Okay, prior authorization does not happen for all prescriptions. It only happens for specific prescriptions. It could be tier 3, tier 4, tier 5 prescriptions. Oftentimes these are more expensive medications. They could be classified prescriptions such as opioids. So it's just really important to be aware that you will have a prior authorization process. Let's talk about formulary exceptions, because one thing that we are seeing right now, an unfortunate consequence of the Inflation Reduction Act that we have seen are formularies are actually being cut, reduced, that the amount of prescriptions each plan is actually reducing. So oftentimes what we see right now, more than we ever have, are prescriptions not being covered by any plan, okay? So what does that mean for you? What does that happen if you're in that situation? Well, I don't worry about it too much, because again, we see this very often, and here's exactly how you can handle that is, one, there's a standard Medicare form that your doctor's office should have access to that allows for a formulary exception. Now, it doesn't mean that they could just fill it out and send it to the insurance company. There's a specific process first, and the first thing the insurance company is actually going to make sure is that you have tried a different prescription that is on the plan's formulary first. So whether that's you've tried that in the past, or if you've never tried that, then you do need to start that now before they will cover that prescription that's not on the formulary. So let's use the example. If you've tried a prescription in the past and it did not work, or maybe you had a bad reaction to it, your doctor can provide that information to the insurance company, and that formulary exception could get approved for the next month. So there's different steps and different processes to be aware of. Your doctor's offices should have that information. And our whole team here at Gruning Health and Wealth is prepared and has the knowledge and understands the process for if and when that does happen to you. So those are some big things to be aware of when it comes to avoiding penalties, making sure you're in the right plan, and then again, making sure you have the correct resource and someone on your team to review these things with you every single year. There are constant changes, and we just want to make sure that you're always in the best option for yourself. Hopefully this video helped simplify Medicare prescription drug coverage and gave you a better understanding of how Part D actually works. If it did, make sure to like this video, subscribe to the channel, and leave any Medicare questions you have down in the comments below. And if you want more help planning for Medicare, we've included links in the description below to book a free one-on-one consultation with a Medicare specialist and to get a free copy of our Medicare and Retirement Planning book 64+. Both links are in the description below. Thanks so much for watching, and we'll see you in the next video.